Yeah, we are all set. Just a second. So I hope you are all putting the feedback for Dinesh. I could just give a stream live. Yes, we are done. So technically we are okay. So I welcome Rajat as a second speaker for our session today. He is a second pharma star who would be talking about his experience in telemedicine. Telemedicine has picked up, really fast during this COVID, and telemedicine has helped, our pharmacy professionals and healthcare professionals to reach thousands and lakhs of patients who are in need. So Rajat has very closely worked with the core COVID-19 team in Karnataka, and today he is here to share us his experience. Rajat is currently doing his B Farm in Vivupuram College of Pharmacy, Bangalore, and he is a proud pharmacist. He not just does pharmacy works; he is also into a lot of volunteering work. And now I welcome Rajat, and Rajat will share us his story and then continue his experience with telemedicine. So welcome, Rajat. Thank you so much for being with us. And the stage is all yours, and you can share your story from here on.
Yeah. So hello everyone. Good morning. So thank you for such a wonderful introduction of mine, sir. Thank you very much, and thank you everyone for joining this session on a Sunday morning and taking out your time and encouraging us, and also by learning something on a Sunday morning. So Manoj sir, thank you very much for molding us in every possible way for all these days, and giving us this platform for presenting ourselves what we have learned in the due course. So thank you very much, sir. So let me start off.
Perfect. Go
Yeah.
on.
So my name is Rajat K. Bharadwaj. As Manoj sir told, I am studying fourth year B Farm in Vishweswarapura Institute of Pharmaceutical Sciences, and I am currently pursuing my seventh semester. I also worked as a telemedicine volunteer during the COVID-19 pandemic. That is during the first wave of COVID. I worked as a telemedicine volunteer, which was organized by Health and Family Welfare Department, Government of Karnataka, along with Ayush Department. So I have this experience of speaking to more than 3,000 patients. So also I have worked here for a span of 7 months, and not only have telemedicine experience, but also have some sort of patient counseling experience after this. I also spend my time uh, volunteering in other NGOs such as Spark and Robin Hood Army and Bengaluru Navanirmana Party. So out of which Spark is one of the biggest student-run organization in Bangalore, which aims towards educating and tutoring the underprivileged kids in orphanages as well as in government schools and underprivileged schools. We have also relocated an orphanage recently, which was in a clumsy area to a spacious place. We have also provided healthcare services to various government hospitals, including the primary healthcare center in Devanahalli, primary healthcare center in Vijaypura, primary healthcare center in Hoskote, and all of that. So we have, as a volunteer of Spark, I have personally helped the Spark to procure all the medicines, drugs, PPE kits, masks, and all the COVID essentials. And I'm pretty much um, proud to be a part of that organization and be in such a responsible position. Also, in telemedicine services, I have counseled like more than 1,000 patients of various age groups of, say, elderly with comorbidity, and people who have contacted COVID and being found COVID positive, and many such examples. So thank you so much for giving me this opportunity, sir. Let me start off.
Pleasure is mine, Rajat. Go on.
Yeah.
All the best.
So what are the takeaways by the end of my presentation? What are the key takeaways you will be able to learn? So first one, you'll know the basics, pros and cons of telemedicine, what telemedicine is, its advantages and its disadvantages. So the basic stuff. And then you'll get an overview, a big picture of my experience in area of telemedicine and patient counseling, which I've gained all these days. And thirdly, how you as a pharmacist can develop skills attributing to patient counseling and telemedicine. What are the essential skills which you can learn in your while doing your BPharm diploma or masters or whenever in the area of patient counseling, which will make you a better listener, better pharmacist. And finally, how pharmacists play a vital role in saving hundreds of lives and providing right telemedicine services. So these are the takeaways which uh, I'm looking forward to deliver you in the coming speech. So
Excellent.
yes, sir. I'll start sharing my screen.
So for all of you, please complete the feedback form meantime for Dinesh, and next you can do it for Rajat as well later on after the presentation. Rajat, just do it. Control F5 or F5. Yeah, perfect. Go on. Thank you. Full screen. Yeah.
Yes, sir. Are my slides visible?
Yes. Perfect.
Yeah. So telemedicine, what and why? So this disclaimer, all the views and thoughts expressed is my personal experience and my personal thoughts, and they do not attribute to any other organization. So yeah, let's start off. So what is telemedicine? The concept of telemedicine. So telemedicine, World Health Organization defines it as healing from a distance. So telemedicine was very foreign to Indians. It was not new. It was not known. So but now it has become an inevitable part for everyone. Before the pre-COVID era, no one knew about what telemedicine was, how it works, what telemedicine is, how can we consult a doctor by sitting at home. No one knew about that. But now each and every one knows what telemedicine is. uh, I mean, just by having a smartphone in your hand, how and all you can um, make use of it for your healthcare benefits. So it defines it as healing from a distance. It uses telecommunication technology and information technology to provide remote clinical services. So it is providing healthcare clinical services with the use of technology. So there is a great need, there is an enormous need for us, we as pharmacists and doctors, to upgrade ourselves from the traditional way of dispensing and all of that to upgrade to implement technology in the field of healthcare. So telemedicine, it is basically these elements of telemedicine. So it is basically nothing but pillars of telemedicine. You can call it as pillars of telemedicine. So its purpose is to provide clinical support, yes, and it is intended to overcome geographical barriers, yes. So there are a lot of topographical challenges which a doctor might face. Not just I mean, in India there are plateaus, there are plains, there are Himalayas. Doctor cannot reach everywhere. Doctor, he is also a human just like us. He cannot reach everywhere. So just by having a mobile phone, just by having a smartphone, what he can do is he can consult the patients from the place where they are. And it involves the use of various types of ICT is information communication technologies. I mean, the technology which is used to transmit information from the patient to the doctor. And fourthly, the goal is to improve health outcomes. So the overall goal is to provide easy access to healthcare, easy access to health to all of the people. So when we look at the history of telemedicine, one minute. Yeah, sorry. Yeah. When we look at the history of telemedicine, it began somewhere in the mids and early 19th century. So the University of Pennsylvania. So these were the people who were involved in firstly transmitting the medical records for about 24 miles. So by keeping this concept, the Canadian doctor, he built a technology in 1950 for patient counseling and all of that. The first people who were to use video communication were the people of University of Nebraska. So what they did was, in the first 5 years later, they developed a technology wherein a state hospital performed video consultations. So this was the first in 1959. They started these telemedicine services, and you know how big the telemedicine industry has become right now. So all the doctors, all the practitioners who are aged, who had discontinued their practicing, have all started their practicing again just because of this wonderful technology, wherein they can just do the consultations, they can practice from their home and benefiting hundreds and hundreds of people. So next we'll talk about why telemedicine. What is the need for telemedicine? Why do we require telemedicine when we have such robust hospitals and all of that? What is the need for telemedicine? So there are different needs. Yeah. So we can categorize it as two things. One, advantages for practitioners, and another, advantages for patients. So first we'll go with the practitioners. So for practitioners, reaching the undeserved population. So this is, as I told you, India has a lot of topographical variations. So the doctor cannot access everywhere. Say a doctor in Bangalore who is a specialist in cardiology, he cannot access to a patient who is in Assam. So what he can do, he can just book a consultation appointment in his smartphone and get the service done. So reaching the undeserved population, that is a great advantage. Increasing the pool of potential patients, leading to more revenue, delivering more patient care. So whenever, so most of you here have smartphones here. So out of the 15 participants, I'm sure that 15 of them also will have their own smartphone. So by having your smartphones, you are accessible to a better healthcare. All you need to do is just book an appointment over the phone. So who all have a cell phone of their own are accessible to it. So gradually there is a larger market for the doctors, larger market for consultation. So there is an increase of market to the doctors. Then offering more affordable care and services. Yeah, offering, so the care, when you go to a hospital or when you go to a nursing home, they somewhere charge you around 1000 for one consultation. But the same, when you consult it over the telemedicine, you are charged only 200-300 bucks. So there is a lot of economic aspect towards it. Next, you have strengthening the patient relationships. Yes, this is something which is very important. This is uplifted the healthcare system actually. So a patient, whenever he is in a emergency condition, or whenever he has to whenever he wants to consult a doctor, he cannot just rush into the hospital. It is practically impossible. He has to he has to know how to ride a bike, or how to ride a car. Then he has to bear all the traffic and all of that. But now, this had because of the use of technology, what he can do is just book an appointment, or even call the doctor and explain the situation. This and this has happened, so what can I do, what can I do to come out of this situation? All he is just one call away from the doctor. So this is something really beneficial for both doctors and the patients. Next, the decreasing the likelihood of no show ups of appointments. So there are doctors, not all doctors are successful. So there are doctors, there are practitioners who practice in small clinics. So this is a great advantage for them. What they can do is just register themselves on these platforms where they offer telemedicine services. Say you have Practo, you have Easy Doctor, you have so many platforms. All he has to do is just register himself on the platform, and the appointments are booked. And uh, based on the availability of the doctor and the patient, all he has to do is just do his smartphone ka business, and his appointments will be done. And it is very beneficial for both the patients and the doctors, mostly for the doctors who are underperforming. Next, we have prevent crowding in the hospital. Yeah, this is one aspect. I'm sorry. Yeah, prevent crowding in the hospital. There is, so how many of you have recently visited the hospital before COVID era? Just raise your hands so that I'll get to know.
Yes, participants, yes, please. So Ojas has raised his hand.
Yes.
Only Ojas, only one person?
We have healthy participants.
Okay, two. Nutan has also raised his hand. Okay.
Yeah,
Not just for you, maybe for your family members or
yeah,
relatives
yeah, yeah.
or friends. Dinesh has also raised his hands. Okay. Sadia, yes. So many of us.
Yes. So visiting an hospital is inevitable. So prevent crowding in hospital. What it attributes to is, so whenever I mean during this condition when there are communicable diseases, so there is a lot of crowding in the hospital. There are high chances of getting infected. So this can be prevented by telemedicine services. So there is no need for the patient for my patient of having minor ailments and all. He need not come to the hospital at all. All he has to do is book an appointment. That's all. So there are many more advantages. You can just keep on listing down, and it is like endless. So this is how technology. This is what technology has given us these days. But for patient, what are the advantages for patients? Let's look over it. So not having to travel to an appointment, as I mentioned earlier, he should not he need not travel in an emergency condition. All he has to do is, sir, a doctor, he call up a doctor and ask, sir, what can I do? What is the preventive measure? What he is going to give his views and thoughts and remedy towards it. So traveling expenses is also cut short. Next, we have prevents transmission of communicable diseases. As I told you earlier, so there is a lot of scope for getting infected after visiting a hospital. You have nosocomial infections whenever you get admitted to a hospital. So all these things can be avoided. All these communicable diseases can be avoided by getting a consultation booked at home and getting this telemedicine services. Look at the advantage of it. Next, you have economical, especially compared to emergency room or walk-in clinic visits. So whenever you want a doctor to visit your place, you know how much he charges. Not less than 2,000 rupees, depending upon the distance. But he does not charge anything anywhere I mean below 2,000 rupees. So there is a economic point of view. You can save a lot of money by booking telemedicine services, not worrying about shortage of local specialists for rare conditions. Yes. So a person who is staying in Bangalore has some kind of illness, say yeah, uh, normal cough, cold, fever. So he needs to consult a general physician. There are no general physicians in his nearby locality. He is staying somewhere outskirts. What he can do, he has to come all the way through. But no, because of the telemedicine services, all he has to do is, you know what. So next we have technological upliftment of undereducated patients. Yeah. So there are patients who needs um, frequent visits to the hospital. Say diabetic patients, say hypertensive patients, patients with cardiological disorders, and all of that. They have to keep visiting the hospital now and then, very often. So that attributes to increase in cost, and not just that, they'll have to spare a separate time for that in a week. So all this leads to disturbance in their schedule. What they can do is book a consultation in his this one and get a consultation from a telemedicine doctor. So it not just saves his time and energy and money, but also educates him in the background in the um, field of technology. He will be technologically uplifted. There is a need for him to consult doctor every week, but there is not much time. So this leads to this will force him to learn more and more of technology so that he can afford telemedicine services and cut down his costs. Also, the travel expenses are cut short. So these are the few advantages for practitioners and for patients by by opting for telemedicine services. They can save a lot of money, save a lot of time. Not just these two, they can get a very um, specialist. They can get a specialist advice for these conditions also. Say a specialist is saying staying from far from the city, they can get his consultation also. So there are a lot of advantages by using this telemedicine technology. Next, we move on. So whatever has advantages, it must have a disadvantage, right? So we as pharmacists, we know that every drug we take in, it has its own side effect, adverse effects all. So even similarly, telemedicine also has few disadvantages. What are they? Let's see. Okay, let's look at it. So physical examination of the patient is compromised. Yeah, this is one biggest disadvantages. Physical examination. Whenever you visit a clinic, so the doctor, he doesn't just prescribe medicine just like that. He doesn't just open his writing pad and prescribe. What he does, he examines your eyes, he examines your ears, he examines your tongue, your heart rate, your vitals, and all of that. He has to do that protocol. That is a standard protocol. That protocol is not being followed here. This is one biggest disadvantage. So the doctor can see you via video call, but he cannot examine you over the video call. That is one disadvantage. Maybe in the coming days, uh, based on this 3D technology and all of that, there are chances of um, newer technology, and there is scope for improvisation regarding this point. Say there is a dermatological condition for a patient. Say he complains of scabies or something. He starts itching skin at night, but the patient, I mean, the doctor hasn't examined it correctly. He just knows the symptoms, and he has probably seen his skin or something, but the doctor is unsure whether it is scabies or whether it is any other fungal infection. He's unsure about it, but anyhow, he is being consulted over telemedicine. He has to prescribe, he'll do his part. So this is one disadvantage. This can be either no effect to the patient, or there may be adverse effect to the patients. And for psychiatric disorders which requires counseling, you cannot just call the patient and counsel him over the call. That is not the proper way of doing it. So psychiatric disorders, neurological disorders, there are many disorders, and for patients who require dialysis and who require patient services, there is a disadvantage. And the next we have patient lacking education on technologically backward patients. Yes. So how many of your mothers, how many of your grandmothers are technologically well equipped? Participants, I'm asking you. Yeah. Any of your mothers or any of your relatives are that well versed in technology? There are not much people. I mean, there are not. In a country like India, where technology, where smartphones are new, where a smartphone is something very exciting and very new for our elderly generation, they lack this technology. They lack this technological education. They do not know how to uh, do a video call. They do not know how to book an appointment. They do not know how to handle a smartphone, basically. So this is one of the drawbacks. We'll have to ask one more person to do it. So this is one drawback of it. And prescribing narcotics is risky. Yeah, for the doctor, he may examine the patient and he may diagnose that the patient is suffering from, say, sleeplessness. He just cannot prescribe narcotics, schedule X drugs for him just like that. There is a very high chance of addiction. So this is something very serious. So this is one of the drawback. And administration of the drugs is not possible. Yes. So if the patient complains, so there are cases when patient complains that he is feeling very tired, he is not able to move, he is diabetic and all of that. The doctor who he has consulted over the telemedicine, he might just tell him to take a few electrolytes and have a sugary diet and all of that. But if his condition is so that he requires IV infusions, he requires medicines um, via IV route, then it is not possible by telemedicine services. They cannot offer patient care services. All they can offer is just prescribing medicines. Next, lack of connectivity in rural places. Yes, this is also a biggest barrier for telemedicine. So as of 2018, statistics tell that there are over 14,700 villages in India that lack electricity for domestic use. So these villages, they lack electricity for domestic use, and we are talking about smartphones. So that is one of the major drawback. Until these 14,700 villages are electrically electrified, and unless they get these smartphones, unless they are well equipped with the technology, it is practically impossible to implement telemedicine services in such areas. The authenticity of the doctor. Yes. So how many of you here have ordered medicines over Netmeds or 1mg or any online platform for that matter? How many of you? Yes, Sadia says she has, and we have Nutan. Okay, okay. Yeah,
Dinesh also.
yeah, Dinesh also. Yeah, in this era, so traditional pharmacies are being um, not actively, I mean, the traditional pharmacies are facing losses because of this. There is a huge monopoly of online pharmacies. And the one more question I need to ask. Yeah, Dinesh, or yeah, Dinesh. Hello. Yeah, Dinesh. You have ordered the medicines over online, right? So during that time, when you had not uploaded the prescription, so did any of them call you telling that he was a doctor and he wanted to confirm whether you wanted that medicine or not?
No.
No, there was no doctor who did not contact you.
No.
Okay. Did you opt for OTC medicines or something?
Yes, yes, yes.
Okay,
I ordered a
okay,
Candid TV shampoo.
okay, 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 fine. So, but basically, what happens in these online pharmacies is, so this telemedicine. So there is one doctor who calls you after you order for medicines over online. If you do not upload your prescription, he calls you and he claims that he is a doctor, and he asks you whether you want this medicine and what for you are wanting this medicine, like that. So there are Schedule G drugs which have to be dispensed, and which have to be administered only in presence of a healthcare professional. Because of this, so the authenticity of the doctor. So that person who calls you, he might not be a doctor. How sure are you that he is a doctor, right? You all you have seen is he wearing a white coat and speaking to you through the video call. So how sure are you that he is a doctor? This is one this thing drawback. And misuse of e-prescriptions. Yeah, there are e-prescriptions which are being sent to your mobile phones, which the pharmacist dispenses just like that by showing that. So there is a greater chance for misuse of these e-prescriptions. Say when he prescribes narcotics or something, narcotic drugs, this patient goes and purchases the medicines over and over and over and over, and maybe he gets addicted to it. Maybe tolerance is developed for towards those drugs. So there is a lot of scope for improvisation in all these aspects. So there are many more disadvantages. So speaking about advantages and disadvantages, might go for hours together. So next slide. And yeah, safety. This also, yeah, safety of patient data is compromised. So whenever there is a telemedicine consultation booked for you, so there is a series of questions which you need to fill in, whether you are diabetic, whether you are hypertensive, which medicine, which drug you take, the brand names, and what all medical devices you own at your home. And there is a lot of data which you need to enter before you book a consultation. So whenever you do this, there is a lot of data gathered about you. There is so much of data that each one of us contributing towards that, and there is a great potential of that data being the safety of that data being compromised. There is a lot of scope for misuse of that data. So there are these pharma companies which uses these data and develops their brands. So this is one negative attribute towards telemedicine. Next up, we have my experience as a telemedicine volunteer during the COVID-19 pandemic. Yes. Yeah. So during the COVID pandemic, when it started in somewhere around in March 23rd, I suppose. So we were all jobless for say 2 months until during the lockdown period. So there was this one link from RGHS wherein you need to fill if you were willing to provide any sort of services for during the COVID-19 pandemic, because there was shortage of doctors, shortage of pharmacists, shortage of healthcare professionals. So there was this one link which generated all over the place. So I just filled in that link, and I received this confirmation message from them. So one funny part of this was, so you can just read through the message. So, dear doctor, you are drafted for working in telemedicine call center by Government of Karnataka. You are requested to attend a training session in telemedicine call center tomorrow, 21st of 4, 2020. So, pickup and drop arrangements will be made. The details will be sent soon. Thank you. So, this message, I received it on just a previous day, wherein I had to go on the next day. So, and look at the timings. It was 11:31 p.m. So I received this message at 11:31 p.m. and the next day I have to go. And you all know that during that during the first wave, how serious things were. But thankfully, my parents were very encouraging in those aspects. My father and my mother, both of them, encouraged me to um, give my services towards the society. So yeah, I was then how it started was because of this registration and this message, and I was drafted into that global village, RR Nagar Global Village, wherein there was a whole campus for us. I'll show you in the coming slides. Yeah, this was the letter. Describing my work, my role, and this one given by given on the first day after I joined. So this was the workplace of ours. So we had to, we used to receive these calls from the patients. There was this helpline setup called Aptamitra Sahayavani, which with the number 14410, wherein patients, patients across Karnataka used to call this number, and the call used to get transferred to each of us. So there were pharmacists, there were homeopathy and Ayush practitioners, basically Ayush, Ayurveda, Unani, Siddha, homeopathy, naturopathy, and yoga. So all these practitioners, all these interns, and not just interns, also students who were studying second, third, fourth year of their Ayush course, and pharmacists were drafted into this. So the call used to come to us, and we had to counsel them. There was something called as customer relationship management, called CRM tool. So we had to take down the data of the patient, collect the data of the patient, what symptoms he is suffering from, if there was any travel history associated with. So we had to collect all these data from him, and we had to document it, and then we had to send it to a level 2 doctor. Basically, there were two levels, level 1 and level 2. So at level 1, we all these categories, the Ayush students, Ayush practitioners, and pharmacists, they all were at level 1, and the MBBS graduates, MBBS students, basically they were at level 2. So we were involved in patient counseling and taking the patient data, wherein level 2 people, they were involved in um, analyzing the data and prescribing medicines for the same. So basically, this was the nature of work which I initially started. Then we have the nature of the work. Yeah. So yeah, as I mentioned before. So firstly, we had to take down the patient case history and document it in the tool given here, and then we had to evaluate the case, whether if it is COVID, non-COVID, or asymptomatic. We had to just evaluate based on the symptoms. So we had flags for that. So red flag, when red flag was raised, that was suspecting COVID, and there were yellow flag, blue, white flag, and various other things. So this was this was what we were supposed to do. Then we had to escalate to the level 2 telemedicine doctors after taking down the case history of the patient, whether he had travel history, whether he had contacted a COVID positive person, or if there were any cases in his family. So based on all this, we had those flags raised, and then the follow up with these cases, and patient counseling if the patient follows up. Yeah, and not just this, there were other campaigns also associated with this. So other campaigns include direct patient counseling. In this, I told you the calls from the public come, and we had to receive them, we had to counsel them. There is one saying there is one saying called, a doctor is a one who cures the least, cures the least, comforts mostly, but consoles always. Yeah, it goes like this. The doctor is the one who cures rarely, comforts mostly, and consoles always. So my part of the work was to console the patient. That is one of the hardest job to do ever. So you all know how difficult it is to console your parents for a matter of a new mobile phone or new laptop or whatever. You know how difficult it is. Just imagine consoling patients of various age, various categories, various socio-economic background, and consoling patients who have been tested COVID positive, who are in a panic state, consoling patients who are carrying women and being tested COVID positive, and consoling elders who have been tested positive. So this was basically what we were supposed to do, and there was so much scope for learning that I learned so many skills like being responsible, being a good listener. That is which is vital for a pharmacist. Being a good listener is very essential for a pharmacist. And patience is something which we the younger generation lack. So patience also, and there were so many other skills which I learned through. So this was one such this one. And then we had this called as, there were various other campaigns wherein these telemedicine volunteers, they were divided into various categories. So category 1, category 2, like that. Then they were given with these campaigns. So luckily I had been a part of direct patient counseling and quarantine breach campaign, and elders with comorbidity campaign, help desk campaign. So I was a part of all these campaigns. Luckily for they were selected just a few students from all the lot, and made them into groups and assigned them with special work. So then there was quarantine breach campaign. Yeah, you all know what quarantine is by now, so it is very familiar for you all guys. So there were people who used to breach their quarantine. So they were supposed to be in their respective homes, when they were in under home quarantine, but they used to breach these quarantine, and they used to step out of the house, roam all around, and all of that. So what we had to do is we had to call them and ask why they breached the quarantine, and warn them if they were doing it frequently, and if they were doing it with purpose, and all of that. So that was basically the quarantine breach campaign. Then there by during this quarantine breach campaign, I personally um, witnessed all kinds of people. There were people who were arrogant. There were people who were very sweet to us. There were people like all kinds of all people with various mentalities, various. I mean, not just Bangalore, right? There were people from all over the Karnataka. So there were people from Raichur, there were people from Belgaum, there were people from Davangere, everywhere. So you know their mindset changes, their age is different, their environment is different, how the way they speak is different, their languages differ. Not just that, because of the COVID lockdown, there were a lot of people who could not. Yeah, there were a lot of people who could not open their shops, who were economically devastated. So there were such people. So basically, there were all kinds of people. I got exposed to like literally all kind of people. And then there were elders with comorbidity condition. Yeah, there were these patients who suffered a lot because all these hospitals, they had been assigned as COVID hospitals. So there were patients who has to go for daily blood transfusion, or say for their general consultation, say for dialysis. There were a lot of other complex conditions where they had to go and get treated in the hospitals. But these hospitals became the COVID hospitals, so they were not able to visit the hospitals. So they had this panic: what to do next? What next? There were tuberculosis patients. I remember this one case where the patient was a tuberculosis patient. She was a lactating mother. She was not able to visit the hospital. Neither was she able to visit any other medical stores or anywhere, because she was being quarantined in her home. So there were so many challenging situations. Handling them were really difficult for us. It was moreover like an emotional roller coaster every day. Initially, there was some sort of, there were less number of calls. Say for first 10 days or something, we were kind of jolly. And then it started. Then this platform became available throughout Karnataka. Then we received various kinds of problems from various people. There are pregnant. There was one more case. Yeah, there was one more case wherein the she was a pregnant carrying woman. She was in her ninth month. She had her delivery date in coming 3 to 4 days, and she was tested positive. And one sad part was the doctor who was supposed to perform the this thing, who was C-section. He is like, he's not going to do the operation and all of that. So they were in a panic state. So those kind of patients. And there was one this one ventilator case. So there were so many ventilator cases actually. They required a ventilator. It wasn't available. I had calls from various sources, and I had to contact these people and then check for availability of ventilators, availability of beds in the hospitals. That was one difficult thing. So elders with comorbid conditions, they suffered a lot because of this COVID. Say if they had telemedicine, they had new telemedicine services from then, and if it had become that famous in India before, all these things could have been avoided. So use of technology is so very important. Then we had this help desk campaign. Yeah, in this campaign, basically we had to check the availabilities of hospital beds in various hospitals, different hospitals we were given. And we were given with the contact numbers, and this one contact numbers of various DHO, THO, that is district health officer, taluk health officers, and the zone in charges, and all the healthcare professionals who were a part of government. So we had to contact them. We had to arrange for beds, arrange for ventilators. And there were cases wherein the people who were at home isolation, people who were at home isolation, and there was an emergency, and they could not handle it, and many of them actually passed away because of the same. So after that, they did not know what to do. Their home was completely sealed down. There were neighbors, but neighbors refused to help. They are unaware of what to do. They used to call us what to do, what was the protocol. We had to send them the SOP, what they are supposed to do, from where they are supposed to get the PPE kits, whether they are allowed to carry out all the final rituals or not. So there was a whole lot. We had to counsel them. We had to educate them regarding all these conditions, all these things. That was also a part of help desk campaign. Apart from that, there were ambulances and hospitals. So this was basically help desk campaign. Then we had COVID test declaration campaign, tuberculosis campaign, and pregnant women campaign. Yeah, these pregnant women, there are in government of Karnataka, they give something called as Tai card, wherein they can avail so many nutraceuticals, so many tablets, so many medicines. And some amount of ration and all, ration also, extra ration and all of that. So these women were not able to visit the hospitals to get themselves checked. So the mostly underprivileged women, they lacked, I mean, they were not able to visit the hospitals because of the COVID situation. So we had to personally call them, personally book appointments for them, and make their work easy. And there was, this lactating mother campaign also, similar to that of a pregnant women campaign. So they also required extra nutritions and all of that, which the government provides. So they were not able to access to those services because of the COVID, because hospitals were filled with patients, and there was high risk of getting infected if they visited the hospitals. So we had to educate them and tell them that no, this is not the right time. Like mostly people from various parts of Karnataka other than Bangalore. So most of the women, they opt for these services in the local hospital, district hospital or town hospital. So their prime source for ration, their prime source of for medicine is these hospitals. So when these hospitals have been turned into COVID wards, they were completely puzzled. They were surprised. They did not know what to do. So these two campaigns, basically what it did was to call them and guide them with what to do, and book appointments for them in the respective hospitals, check the availability of the doctor, guide them with all the inputs, all the inputs like phone number or address of the hospital and all of that. And COVID, this one also, there were COVID mobile testing vans where we need to provide, we had to provide the communication details to all other this thing. So this was basically the overview of various campaigns um, which was there in the Aptamitra telemedicine services, and which I was part of. And next I come to the certification. So basically this was the certificate provided by um, the Ayush department along with Department of Healthcare and Family Welfare. Not just the certification, but one more thing which um, one more thing was one more greatest thing what I could witness was, certificate was a secondary thing. I came across, I communicated with more than 100, more than 100 plus homeopathy professionals, and more than 100 plus Ayurveda professionals, and 30 odd Unani and Siddha professionals. So these were the students who I could communicate, who I actively spoke to, and what I got to know what is going on in their field, what we as pharmacists can attribute to their field. So I could get a lot of inputs from all these sources. So what I think is, there is a lot of scope for pharmacists in healthcare, but we as pharmacists lack. We do not. We are not susceptible to it. We are not able to recognize where the opportunity is, what we can do as a pharmacist. So I spoke to these homeopathy professionals and Ayurveda professionals, and also there were floor doctors, wherein these floor doctors were people who are highly qualified government doctors, who are teachers also in Ayurveda, Unani, homeopathy colleges. So I had these floor doctors also. So we had very healthy discussions very often regarding their system of medicine, our system of medicine, which was better. And all these discussions were there. So apart from the certification, that is something which is very valuable, which no money can buy. So I had this interaction with all these people, and there were also people from family and healthcare Department of Family and Health, Family Health and Welfare. So wherein these were government officials, they were guiding me with what you can do next, what you as a pharmacist, how you can get into family and health Department of Health and Family Welfare and serve the people, how you can get into this one, what you as a pharmacist can do in order to uplift them. They had a vague knowledge of what was lacking in healthcare system. So when I spoke with them, so they gave me inputs regarding this can be done. This is where some of uh, some of the people are needing most of the this is where people are spending most of their money, what we can do to tackle this. So these people, these government officials gave me these inputs. They also gave me immense support, and also the floor doctors. We constantly had so many debates regarding Ayurveda, regarding homeopathy, regarding English medicine, modern medicine, all of that. So this enriched my knowledge hundredfolds. Like from before the Rajat, which I went before I joined telemedicine, and after I joined telemedicine was completely two different personalities. So after speaking to so many people, my communication, the way I communicate with people, and all of that changed gradually. And the language, yes, it also improved drastically. I had this fear of speaking in front of public. I was such a fearful person. I was not a person who used to um, talk so openly with the public. That also changed. So there were so many changes which I witnessed within myself after providing these, after being a part of this telemedicine health telemedicine campaign during the COVID-19 program. Then what are the key takeaways? So as I mentioned above, I mean, as I mentioned before the presentation, so these are the things which are the key takeaways of this presentation. Firstly, grab every opportunity which is thrown at you. Yes. So one thing I observed in that was during the telemedicine services was, so there were this Google Forms link sent to everyone, but out of 40 of us in Global Village Emphasis Campus, out of 40 of us, there were only 7 pharmacists. This is something which was a point of concern for me. So there were only 7 pharmacists. Rest all were from Ayurveda, Unani, Siddha. They kept on changing, however, but we as pharmacists, we know pharmacodynamics, pharmacokinetics, pharmacology of drugs, which drug to give when, and modern medicine, we are more well equipped with modern medicine and modern technologies rather than Ayurveda, Siddha, Unani, homeopathy people. We are technologically forward, we are educationally forward than those people, but what we lack is grabbing that opportunity. So because of that, we were all placed at the same level. All the homeopathy, Unani, Siddha practitioner, all of us were placed at the same level, except the MBBS guys who were placed at the level 1. So sorry, level 2. So we were all placed at the same level, but there were only 7 pharmacists. That was highest in any other branch. I mean, any other campus. There were only 3 pharmacists in the second shift, 2 pharmacists, 1 pharmacist. There were no pharmacists in other sections at all. So this is something point to be considered. So pharmacists, there are opportunities, there are plenty of opportunities, but the pharmacists are not grabbing that. So they imagine a Ayurveda professional prescribing paracetamol to you. He does not know the structure of paracetamol. He does not know the half-life pharmacodynamics of paracetamol. All he knows is few brand names, and he's just prescribing all over. Then what is the point of we being educated so much? So one thing, so kindly grab every opportunity which is thrown at you. Then networking is very crucial. Yes, as I mentioned, I spoke to nearly 100 plus Ayurveda students who are pursuing their second, third, fourth year in Ayurveda, interns and all of them, and practitioners also. And I remember three of Ayurveda doctors who were floor doctors to us, Dr. Shivram sir, who is currently a government doctor and a professor of Ayurveda in Homeopathy College, and Dr. Rati ma'am. There were Dr. Guru Prasad. There was Dr. Rati ma'am, yeah, and Dr. Mahesh. So there were so many people. But yeah, networking is very crucial. So I got a network of all these people. So then I got to know what opportunities were there in their field, what a pharmacist can do. A pharmacist can open a homeopathy shop, homeopathy retail shop, homeopathy manufacturing, homeopathy say wholesale retail shop. So the market of homeopathy is increasing. So what I can do as a pharmacist in their field, I got to know that. And regarding Ayurveda also, Unani, Siddha, yes. Then development of problem solving skills, yes. This was something very, very common to us, very common to us. There were, as I mentioned you, there were patients who required immediate ambulances, immediate ventilators, immediate beds in hospitals. So there were one. I remember this one case wherein it was almost 2 months where after I had joined. So there was one patient. It was a peak of COVID, and there was this patient who required a ventilator. He was, she was speaking to me over the phone, and I was just documenting all the inputs which she gave. And her mother, who was 50-year-old, I still remember all the case details. I'm just not revealing it. I remember she was 50 years old. She was staying in Mysore, and she wanted an immediate ventilator. I somehow arranged for ambulance, and the ambulance is on the way, but the patient just passed away. That was something very I just cannot explain that situation then. So after that, I was completely shattered. I was emotionally completely shattered. We as pharmacists, we are not used to all this providing this clinical services. So this was very unique for me. And that situation, just turned me around. Yeah, and 1 minute, sorry. Yeah. So problem solving skills is very essential. So how you react to a problem, how you react to when someone was asking, there were people who are asking beds, hospital beds. So I had to react immediately. When the patient is in the ambulance, he's in front of the hospital. The hospital staff is not agreeing to admit him. So there were so many challenging situations. There were immediate need of, I told you, ventilators and all of that. There were, and yeah, this came remdesivir. Yeah, remdesivir case. So there were immediate needs for this, and there were so much of panic around this. They were not able to find that. We had to contact all this DHO, THO, and all of that. We had to contact the drug inspectors. I got a few contact of a couple of drug inspectors also, wherein they arranged for the remdesivir injection and all of that. So networking also, yeah, networking is also positive, and problem solving skills positive. So I got these two skills also, and a good listener, becoming a good listener. This is very important. Whichever pharmacist you are, being you might be a diploma graduate, diploma student, you might be a bachelor student or a master student. Being a good listener is very, very essential, very crucial actually. Patients used to mm, they used to there were various kinds of people. They used to barge in. They just were arrogant. Some people were really sweet. Being a good listener is very, very essential. So when you listen, you get a lot of inputs. You're not throwing your energy, you are just consuming what the other person is telling. You tend to gain so much of knowledge by being a good listener. So be a good listener, have a lot of patience. So whatever, don't judge a person by his previous, by his looks or anything. He might have so much knowledge than you. So whoever that person is, just be a good listener and collect all the inputs carefully. Yeah. Then develop good communication skills. Yes. um a bit of Hindi also. I was not that good at Hindi, because we had this what migrate these workers who wanted to go back to Bihar, Rajasthan, and all of that. They communicated in Hindi, so my Hindi improved a bit. So also my language skills also improved, and communication skills moreover improved drastically. How I had to communicate my thoughts, my ideas, my suggestions to these patients also improved. And there were cases where people got negative uh, in RT-PCR, and they got positive in rapid antigen testing. So they lack a medical education. They do not know what RT-PCR means, what rapid antigen test means. So they were in a panic condition. We had to console them. We had to educate them regarding these tests. So they used to doubt the system. that these are not being the tests are not being done, these are fake reports, I'm going to breach the quarantine. There were such people. We had to console them, and also um, educating them regarding all these tests was also essential. Implementation and application of knowledge is important. Yeah, we were we were provided with various inputs, various numbers of DHO, health minister, and all of them. There were so many contacts of hospitals, district hospital contacts, state hospital contacts, and PHC, UPHC, all these contacts, and many information regarding all these. Totally, healthcare website was being displayed to us, but extracting information from that and application in specific cases was very important. There might be a patient who requires an ambulance, but you might not know. um, you have read that there is ambulance, where you can assign an ambulance, but you do not know where to implement it. Then there, what is the use of knowledge? Similarly, in your B farm, you have inculcated all the knowledge, say dissolution, disintegration, um, adverse effects of various drugs. Just correlate them. When someone is taking a drug, someone is taking paracetamol, say that is hepatotoxic. So just correlate that to whenever you see that, this thing. So implementation, that is application based learning, is something which is vital in this era, is what I believe. And gain knowledge from various sources. As I mentioned, Ayurveda, Siddha, Unani, also MBBS graduates. So I got to spend my valuable time with them. So I used, there were two shifts, basically 2 to 8, and morning 8 to 2. So we were provided with good food, and this one, yeah, the transport facilities. And luckily there was remuneration declared after serving for 2 months. Until 2 months, we never knew that we are going to get any remuneration for our service. However, I personally had not taken any leave until those 2 months. I had worked completely, and until the 7 months, only in the last month I had taken leave. So I was very consistent in all these 7 months. So basically, this is what I did um, during the COVID pandemic when I got drafted into this. So I kindly request you to grab every opportunity which is thrown at you. Just look for opportunities. There are plenty of opportunities besides, but you are just lethargic towards it, or you're not susceptible towards it. So by this, I end my presentation. So thank you all. Thank you for listening to me patiently. I might have overspoken. Sorry, sir. Thank you. Thank you very much.
Wonderful, Rajat. Thank you so much for that wonderful presentation and so insightful knowledge. And you brushed my knowledge on telemedicine as well. Thank you so much. And so much of practical nuggets you gave. The last slide, that was like a practical pointers for each one of us. So you may stop the presentation for a few seconds, and then we can take some questions if our participants have some questions. Yeah, you can just close the slide sharing. On the top, there will be one red button, stop share.
I'm not able to get that drop down.
Not a problem. I'll do it for you. Don't worry. Yes, I have done it for you. Okay. So participants, how did you like Rajat's presentation? If you have to tell in one word, you can use the chat box and let's see what kind of feedbacks we get. Just one word for 1 hour of presentation. Wonderful. Thank you, dear Rajat, for sharing your journey. And so inspiring. Salute to your work. What else? Fantastic. Okay, what else we have? So inspiring.
Awesome session, sir.
Awesome, Sanket. Thank you. Inspirational and motivational. Wow, nice. So Rajat, that was wonderful session, and it was so inspiring for all of us. And you have achieved so much even during just your B Farm, and then we expect so much from the governments and everybody else, right? Instead of expecting, imagine if we start doing our bit, then we can teach and brings so much of change. So thank you so much for that wonderful presentation. And participants, if you want to ask anything with Rajat with respect to his experience, with respect to telemedicine, of course, restrict yourself to the topic and his experience. You can just raise your virtual hand and then we can take few questions, just 1 or 2, 3 questions max, and then we'll move on to the next speaker. And also please, use the link which I have given in the chat box to provide a feedback for Rajat. I'm sure this will help him a lot and we'll have a better presentation, a much better one in the next session. Okay. So looking forward to receive your feedback. In case you don't have any experience, in case you don't have any feedback not feedback. In case you don't have any questions, then I'll take some general questions from Rajat. Is it okay? I'm looking forward for your raised hands. I'm not seeing anything, but I'll just take one question for Rajat. So Rajat, most of the B Pharm students or M Pharm students or PharmD students, we have this habit of complaining on everybody else except ourselves, right? And we just keep talking that we don't have any opportunities in the profession of pharmacy. So what is one suggestion for people like them?
Yeah. So actually, frankly speaking, there are plenty of opportunities for a pharmacist. Like wherever you see a pharmacist, you just go stand next to the pharmacy. That is one opportunity. You can see what kind of patients are coming, what kind of drugs he is dispensing. He doesn't restrict you for that. So there are plenty of opportunities, not just because of that. There is one. I did not know what to do during the second wave COVID, because all this study medicine was being handled by outsourced. So there was this opportunity from my this Spark NGO, wherein they thought of procuring medicines and procuring all these things and distributing to various pharmacies. So by that, I just got contacts of various other pharma wholesalers, wherein who deals with all these medical kits, equipments, and all of that. There are plenty of opportunities. We should look for it. That's all. We are not susceptible towards it. We are just being resistant. We are thinking that, okay, after B Farm, okay, chalo, let me open a medical shop. Let me do this. Okay, I'm not going to get this one. I'm not going to get well placed as an engineer. This is what their mindset is. There are many engineering companies, software companies, but there are not many pharma companies. No, they will not take me. So this attitude should change. They should look for opportunities in every small thing. Say one of your relatives comes home and with this prescription, just read through their prescription. You get a lot of information and just evaluate the adverse effect what they are facing. When you start with small things, you'll gradually grow up with the kind of things. So
Absolutely.
There is no need to blame government or anyone for that. Our life is our responsibility. It is in our hands. So whether you're throwing it away or making the best use of it lies with you.
Absolutely, Raja. Totally agree with you. And thank you for that. Thank you for that note. I'm sure, all the listeners will have some wonderful thoughts based on that. Thank you so much, Rajat. And
Thank you, sir.
Thumbs up. I'll just take a screenshot. Yes. Thank you.
Thank you very much, sir, for providing this wonderful opportunity to express myself and my learnings and convey it to the fellow pharmacists.
Pleasure is mine. Pleasure is mine. Thank you so much. And Rajat, you ended with two important aspects. First is we have to look out for opportunities. Opportunities are plenty, and networking is very, very important. Networking plays a very, very good role, an important, crucial role for us to connect with people, learn something, and share our learnings with them. So now join hands and let's welcome Swati, who will be talking about networking and net worthing, right? So how networking can help us bring more opportunities, connect with more people, and help us grab the right connections for right opportunities. So Swati, you're most welcome. Swati is doing her B Farm third year from Shirpur RCP Piper, And I welcome Swati. And Swati, the dais is all yours. Please share your story and help us know more about what you do, how you do, and what is your take for the LinkedIn for our pharmacy professionals. So thank you so much for joining us, and we look forward to hearing from you.
Thank you, sir, for describing me. Good afternoon, dear friends. Thank you for joining in. So, as Manoj sir has described me, I am currently third year B.Pharm student doing my graduation from R.C. Piper, Shirpur. So, let me present my screen. I would be presenting on LinkedIn.
Yes, Swati, go on.
Yes. So my screen is visible?
Yes, just tilt it and then you can click on the play button and we are good to go.
Yes.
Yes, perfect. Great, yeah.
Yes. So my topic is Guide to Professional Networking Site, that is LinkedIn.
But we lost your video. I don't know. Okay. Just see if...
So let me check it once again.
Yes, okay. Yeah, so there is a start video option. You can on.
Yes.
And then go back
is
to.
It fine?
Yeah, it's fine. It looks fine.
Okay, sir.
Yes.
Okay, so most of us wants to know that why should we use LinkedIn, or how should I use LinkedIn, and what are the benefits of using LinkedIn? Means in our college, many of our professors says that you should use LinkedIn, you should be active there, but we are not knowing the benefits of LinkedIn. Okay, so let me share it with you. First of all, let's understand what is LinkedIn. So it is a social network that focuses on professional networking and career development. Means on LinkedIn, you can connect with various professionals here, and it is very good for your career development. You can display your resumes. You can search for various jobs. If you are looking for some job, LinkedIn is the best platform. And you can enhance your professional reputation by posting updates, and you can even interact with various people over there. So now the question is, why networking? As I said, it is a professional networking site. So why should we connect with people? What is the need of that? So in today's era, your network is your net worth. If you connect with people, it will help you to develop, to improve your skill set, and whatever will be the trend in the current industry, you would be able to get updates, and it also help you to advance your career and various job opportunities. Now let's have a quick tour of LinkedIn. So I have taken one page here. Here you can see I have highlighted it with a red color. It's home, my network, jobs, messaging, notification, and me. So let's see one by one. Yes. So the first one is the home page. It is the landing page. After creating your account, when you sign in, you first come into the home page. It includes feeds. You can see various posts of various people, and you can like it, you can share it, you can even comment on it, and you can access to connection, profile, messages, and notifications. Then the second one is my network. Here you can see your networks, your connections, the people you are connected with. You can able to view them and the new invitations which you have received. So my network plays that role. And in the job It is a comprehensive career site where you can apply for jobs. You can get various information about the companies you are interested in and much more. And even there is one option called as notification. When you turn the notification on, so the vacancies you are looking for, you will get updates and you will get mail. So you can apply for it likewise. So here is the option, search jobs and search location. So like that, the vacancy you are looking for, you can search here, the location you want here, and you can search. So you can view various positions, and likewise you can apply for it. And there is one more interesting feature, which is messaging. So it leads to instant messaging platform. Here you can, after connecting with various people, if you want to get some information or you want to get the updates, so you can chat there with people and you can get the update. And also you can do video calls and set appointments via messaging. Now there is one more icon, which was me. So it is the place where you can find your profile, which is like your resume. So you can show your career history by posting your work experience, your accomplishments, your education, your current location, and many more. So this should be polished as your actual resume. So you should update it like you are updating your resume, because any recruiter can view it, so that that will be beneficial for you all. Now there are some of the benefits of LinkedIn. You can gain exposure to hiring managers and recruiters. You can demonstrate your knowledge there, your credibility, your leadership expertise. Okay, and you can use it as a research tool. Or as I said, you can, if you want to apply for jobs, so it is a very good platform here. You can follow various companies, and you can also be a part of various groups. Now some of the tips to boost your personal brand on LinkedIn. First of all, you must optimize your profile for search. It should look proper, it should be polished. Okay, so first optimize your profile, then approach LinkedIn like a living resume. So as I said before, you must update everything properly, so it should look good or over there like a resume. Okay, the description should be like that best describes you. And reconsider your profile photo. The profile photo which you are applying should have the background, white background, and it should not be selfie. It should be a professional photo. And get creative with the cover photo. The cover photo you are applying, it should be creative. It should not have too much of typos. It should best describe you, what you are actually doing. And next one is the customize your LinkedIn profile URL. So on setting, there is one option to customize your LinkedIn URL. There, it should be like your full name, your name and your surname. So you should customize it. And even you can write various articles for LinkedIn. And the skills, there is one option of skills. So the skills you have, you can choose it strategically. And you can set your profile to public. It should not be private, because there in LinkedIn there are various companies, various recruiters who are present. So if it will be public, then you will be able to approach to them. So it is very necessary to be your profile public. And you can participate in various groups which will help you to increase your knowledge. Even you can engage meaningfully with various people by commenting on their post. Okay, and your invitation should be personalized. And there is one more option, recommendations. So you can ask your batchmates, your friends for recommending you, or your teachers. That can be more useful, and keep your content positive and helpful. So whoever you are, whatever content you are posting on LinkedIn, it should be creative. Think for at least 4 to 5 times before posting. Is it useful for someone? Is it positive? Is it make any impact in someone's life? Think for that, then post it. Then some of the mistakes we do. Okay, so first one is you aren't connected to recruiters. So if you are not connected to recruiters, then how it would be difficult to get job. Okay, so you should be connected with them. The photo is not clear, it's very old photo, and even you don't have any profile photo there. So you should be having the latest photo, and it should not be blur, it should be the recent one. And a third mistake is you have a very boring generic headline, or a headline that contains too much of typos. So as I said, uh, it should be creative and short, that best describes you. Your profile lacks the right keywords, so you have to put the right keywords there, so you will be able to come in the search results. And your profile isn't public, as I said, so it should be public. And some of the mistakes like we do, um, some of the job positions, in that we comment I'm interested, I'm interested. So that should be avoided, because that creates bad impact over there. We should ask for the mail ID to the recruiter, and we should send our resume to them. So that is the correct way, because some of them have the fraud, they do for publicity. So we should see, and then we should act over there. So that's all from my side. Thank you so much for listening me patiently.
Yes, perfect, Swati. Thank you for that, short and crisp presentation, and we could make the time really well now, right? So we lost some time in between, but then now that is all matched. So thank you for that presentation. And for the participants, how many of you are not using LinkedIn? Type me in the chat box if you're not using. Let's see if we have somebody who's not using. So that means all of us are on LinkedIn, right? Can I assume that? Type yes if all of us are on LinkedIn. Yes, so all of us are LinkedIn. So participants are saying yes, all of us are LinkedIn. So now you know that through Swati's presentation, if you are making some mistakes or if you're not doing it well, then you have some ideas to make it more improvised and connect to the right people. And Rajat has already emphasized on connections and how connections can help us in learning. So with all the first three presentations, we know how to set a goal, then we know how to look for opportunities, because opportunities are everywhere. And now Swati has helped us to understand how LinkedIn can be a great platform where we can connect and do search for opportunities, search for jobs, create our own profile, and then share our own knowledge, right? So thank you so much for Swati, and all the listeners also for listening to us. Now let's move on to the last presentation of the day. Vaibhav, if you are there, please start sharing, and then I welcome Vaibhav. Yes, perfect. So we have Vaibhav with us, who's doing his B.Pharm. He's also a graduate student of Shirpur, KVP Cyber Shirpur, and he'll be talking about time management. All of us have just 24 hours, to do everything we want to do. How well we can define our 24 hours helps in getting the kind of output that we want to. So welcome, Vaibhav, and do let us know your story, short story, and then let's talk about how we can effectively manage time. So over to you, Vaibhav, and all the best.
Thank you, sir. Thank you, sir, for your introduction. It's my great pleasure to hear, sir. Uh, First of all, thank you all participants to join our discussion and interact with live. Uh, let's introduce myself. I'm Vaibhav Mankhet. I'm from Maharashtra. Currently, I'm doing my B.Pharm third year student at KVPS Institute of Pharmacy, Dhule. Other than my college, I have done 2 months of pharmacovigilance training at Pharma Elite, which is linked to Bioinnovators Lab Limited, Pune. Right now, other than I have been working as a campus ambassador in my college, and I have been working on some reviews and research paper in my college. These all achievements are possible with doing my college due to a time management skill. We have to manage our times to do some extraordinary tasks. Uh, and many of time in an industry, some HR or in interview ask us for what you done uh, other than your degrees, और आपने डिग्री के B.Pharm तो किया है लेकिन उसके साथ और क्या स्किल्स वगैरह किए हैं उसके साथ, तो हम बोलते हैं सर we do not have a times to do so and so. So here I am going to talk about the time management skills, how, what, and importance of time management skill. So I feel time management skill is important as all other skills, like whatever it's goal setting, or we want to volunteering, or we want to perform or build a brand in our any media. That's require a time. When we want to perform any activity, we need require a times. That's why. How do we manage a time? Let's discuss about it. After completing this session, after completing this my slide, you will get or learn about the how to manage the times and do more tasks easily. So here I'm going to share my presentation, sir.
Yes, Vaibhav, please.
Please confirm, sir, is it visible?
Yes, it is visible, but I don't know why when we are presenting from phone, the video gets disconnected.
Sir, maybe it's when we are sharing our screens on mobile, sir,
Hmm.
automatically our camera is off, sir.
Okay, fine. On phone it happens. Okay, so I was not aware of this. Anyways, no problem. Go on.
Thank you, sir. So time management, it rightly said that time and tide wait for none. An individual should understand the value of time for him to succeed in all aspects of life. People who waste time are ones who fail to create an identity of theirs. So in that purpose, we need to manage our time. So
I was sorry. Can you make it full screen? Yeah. Now it has come. Okay.
it's a
Yeah,
time. It's about introduction. Here agenda. Here going to what about talk about me. What is time management? What is the important? Why it is time management important? Benefits of time management. After managing time, what benefits we get or what advantages we get after time management? Procrastinating. Here, do you heard about the word procrastinate? Or after doing this, you all about know are we are procrastinate or not? A sign of poor management. Here, I am showing you some signs that you will get some ideas about. Yes, I'm a, poor time manager or not. So after that, I'm going to share some tips for time management. What steps you want to take for time management here. What is time management? The time management is nothing but it's the managing time effectively so that the right time is allocated to right activity. So we all have 24 hours a day, so important is how we invest in it. The time is not a thing to make or manage. Management is a simple management. It's a plan, or how we manage it. It's all about time management. So why it is important, time management. So So effective time management allow individuals to assign specific time to activities as per their importance. Ask yourself which activity is more important, how much time should be allocated to, know which work should be done earlier and which can be done little later. Time management play a very important role not only in organization but in our personal life also. So time is limited. Once it's gone, you never get it back. To be our most effective, we have to use time wisely. Failure to plan is planning to fail. Means uh, the statement is given by Sir Benjamin Franklin, who said he want me to ask. Basically, success doesn't happen by accident. It take a planning, knowing your where you are handy or how you will get this. So this all concept need a time management, and it also reduce our stress. We increase our work output also. When we are more efficient, productive and organized, we have more time to do and enjoy the things and truly love. So benefits of time management: unless we know the benefits connect to ourselves, we won't manage it effectively. So we surely know the benefits of time management. So here I am going to show you what is the benefits of time management. First is make us punctual and disciplined. Time management. If you manage your time, it make you punctual and disciplined. You आप जो काम करते हो वो आपका टाइम में होता है। आप अननेसेसरी थिंग्स पे आप अपना टाइम वेस्ट नहीं करते। इसका बहुत बड़ा बेनिफिट्स है। Boost your morale and confidence. Accomplishing tasks within the stipulated time framework make you popular in organization as well as amongst your peers. People who understand the value of times are one who manage the time and stand apart from the crowd. Individuals who finish off work on time are looked up by others and are always the center of the attention anywhere. So reach goal, objective and faster. Effective time management help employee to reach the pinnacle of success quickly and stay firm at the top of the longer duration. An employee who work just for the sake of working fail to create an impression and never taken seriously at work. And you have to learn how to plan things well and know where exactly they stand in 5 years. Make us plan better. If you manage your time, you automatically make a plan better. Means you are going step wisely and manage your जो गोल है आपका वो मैनेज करने में आपको बहुत आसान होता है. Procrastination. Procrastinate. Are you heard about the procrastinate word? All participants, I want to ask about. Are you heard or are you feel you are procrastinate any times?
So type Y if you have heard of this word. Yes. Yes, a lot.
Let me share. Procrastination is nothing but procrastination. Pro means forward and crastiness means belong to tomorrow. So how we do procrastinate certain things like completing important work, but procrastinate the things that we love to do, watching movies, latest episode on Netflix, वगैरह वगैरह. We all spending 3 hours on movie instead of doing right things like webinars, training workshop, so on. But because of how busy you let, lots of decision to make, your workload getting worse every day. So you tell yourself, I will just do it tomorrow. You don't want to get up and go to work anywhere. You start letting opportunity pass. Delay. A procrastinate word is simple means delay or put off thing until another times. What are the signs of procrastination? So here are the sign of procrastination. It's spending a lot of time on low priority tasks, waiting for the right time to take a or tackle the things, saying yes to people for fewer and other tasks instead of doing what you need to get done, thinking and acting short term instead of planning ahead for future. You know what you should be doing, but you find a millions other things to do instead, spending time worrying and about where to start. So you just don't. These are a sign of procrastination. Are you feel procrastinate? You don't want to get up and go to work anywhere. You start letting opportunity pass, like you live an autopilot mode. So for the overcome the procrastination, you should manage your time. So जी इस टाइम में मुझे ये काम करना है तो वो करना है, एनी हाउ मुझे वो करना है. So how you manage your, or how you overcome this procrastination? After that, sign of poor time management. What are the sign of poor management? Poor time management. So feeling like you are not in control, or always busy but never finish your work, and there is never no time. मेरे पास तो टाइम ही नहीं है, मैं कैसे करूँ, क्या करूँ? Always tired about and lack of focus. बहुत सारी चीजों पे फोकस नहीं करता है, और मिस डेडलाइंस. जो हमें काम करना है, लाइक समथिंग मुझे 7 बजे एक वेबिनार करना है और ट्रेनिंग वर्कशॉप करना है, तो मैं मिस करता हूँ डेडलाइंस. वो टाइम पे फोकस नहीं करता. इंस्टेड ऑफ डूइंग दिस थिंग्स, वी आर स्पेंडिंग टाइम्स ऑन अदर busy things. I'm going to talk about the tips for time management. What are the tips for time management? So first is set our priorities. So prepare to do list or task plan to join down tasks you need to complete against the time slot and assign to each activity. Higher priority task must be written on top, followed by the task which can be done in little later. Make sure you stick to your task list. You do not procrastinate. मैंने ये टास्क जो अभी रखा है तो मुझे वो करना ही है. You can make the chart like piece of paper and write your urgent work or not urgent work, and in second quadrant you just delete not important works, and जो important work नहीं है तो just आप simply eliminate कर सकते हो. तो as this is a tips for first thing. Then next is a do a list and finish your work on time. So as I say, do a just take a piece of paper and add your urgent, not urgent work, and work on it and manage your time wisely. Differentiate between urgent and important. So what is important? Important means if it's a great significance or value, those things which have value, or those work which you need working within times. So it's very important. You need to manage. Then urgent means require immediate action or attention. First finish off what all is urgent and then go through the important. Do not begin your day with something which is not so important and can be done a little later. Like in morning, we all are more productive than our day. So we need to manage our important tasks as earlier or in morning. Do not wait for your boss. Remember reminders they ask for us. Stay focused. While doing an urgent job, or do not leave your workstation. Going for strolls in middle of your urgent work breaks continually and make you lose your focus. So time is energy. How could we maximize our energy? When we say we do not have time to do this, we are simply saying we do not have energy to do this task. So also we heard about the time is money. So let me explain about the how the time is money hour. So what is your rate per hour? Imagine you earn an 30,000 by working on 25 days a month. It's mean 150 rupees per hour. So if you waste 2 hours by watching TV or on social media, even every day, you are wasting 9,000 every month. Now imagine if you could have used this time for learning and new skills or enhancing your knowledge, this could repay you in future. So it's about the time management. Thank you all participants. Let's manage our time effectively and be a more productive. So it's all about the time management.
Perfect. Well done, Vaibhav. Thank you so much. So, guys, one word again for Vaibhav. How did you like the presentation? Was it good? Was it bad? Was it inspiring? How was it? Crisp and to the point. Mind blowing. What else? Any questions for Vaibhav? Please raise your hand if you have any questions. No questions? Okay, then I'll ask a question. Vaibhav, how did you start learning for time management? How was it? What was your breakthrough moment for time management? You are on mute. You are on mute.
Can you repeat your question again, sir?
Yeah. So how did you learn about time management? How did you know that time management is so important and what you should do about time?
Time management is thing. Time is a very precious time. We just invest on good things. Time time is effort as a we just spend on right activities and important tasks on instead of other stuff is things. So we can manage our times as wisely, or we just put important tasks on when we are more productive. That time we can put our task. So important task in morning, maybe our journey, sir.
Perfect. Thank you. How did you learn about this? You're on mute again.
What sense, sir?
How did you learn about this? When did you learn about this? Let me phrase it.
Sorry, sir.
Which year of your graduation or master's you learned about time management?
Time management, sir. I'm doing some activities on college mode, sir. I have done a lot of volunteering and camps वगैरह. So that time I'm not get it, sir. When हमें इस टाइम पे करना चाहिए, वो करना चाहिए, हमारे पास टाइम नहीं रहता, दिन भर हम कॉलेज में रहते हैं वगैरह, तो उस टाइम पे हम वो चीज़ें नहीं करते. तो उस टाइम से मैंने इन चीज़ों को वाइजली सेट करना सीखा, और वैसे हम इम्पोर्टेंट वर्क्स को एज अ प्रायोरिटीज के साथ उसको सेट कर सकते हैं. So it's all about.
Okay. So Sadia has a question for you. Sadia, if you can unmute and ask him directly, that will be great. I don't want to repeat that question. Yes, Sadia, go on.
Hello, good afternoon. Thank you so much, sir. Thank you, Weber, for such valuable session on time management. So I had question that what about those tasks which are neither important nor urgent but still adding values, and if we don't do that, they make feel us guilty, like calling parents or calling friends or near and dear ones. How we can do that time management for them? Thank you.
For that, Sadia, thank you for your question. Your question is the urgent calls but not important. Just we have to manage on others times, like this call. If you have any calls on time, you can manage on another time also.
No, her question is, what about those tasks that are neither important nor urgent, but have values? For example, calling parents or dear ones.
We can manage it in free time, sir. Not urgent, but important. Whenever we are free, that time we are doing another things. So we can manage on that times. Like important tasks, like when we are in college all over the day, and completed our task of the day. In that we are 24 hour a day. हम पूरा 24 घंटा तो काम नहीं करते, उसके लिए हम टाइम अलग से मैनेज करते हैं. जिस टाइम पे हम हमारा टाइम वेस्ट करते हैं, उस टाइम पे हम उस इम्पोर्टेंट वर्क को एड अप कर सकते हैं. कैन आई क्लियर द क्वेश्चन, सर?
Perfect. And another thing is calling parents is urgent also and important also.
Important also, sir. Right.
Okay, so we'll have to keep that point in the bracket, and at least weekly once or daily once, whatever time permits, we have to set a time, because supposing that we want to call them at our free time, they may not be available at that free time, right? So we have to plan accordingly and keep calling them. So thank you, Sadia, for asking that question, and thank you,
Thank
Web.
you so much, sir. I have another question also.
Please go on.
Yes, please.
Okay. We say that time is energy, time is money. So if we calculate monthly our hourly our rate or value, that is our rate per hour, something 250 rupees or something like that.
Yeah.
That is our value. So we have to save our time or we have to save our money. Like I am buying something new, that is a new phone, and I spend my time for online platforms like Flipkart or Amazon, and I get that offer, and I saved my 3,000 or 4,000 rupees. And same phone, I am getting at suppose 3 or 4,000 more in our shop. So I have to save my time or I have to save my money, because 3 to 4,000 is not my hourly rate, no?
Correct. Whether you want to answer that? You're on mute.
Yes, sir. Is it? I am.
Yes, you're audible. Go on.
ओके सो सादिया, नेटफ्लिक्स पे हम जो टाइम इन्वेस्ट करते हैं, मीन्स इन्वेस्ट मीन्स हम वेस्ट करते हैं बोलते हो, जिस टाइम पे हम उसमें से कुछ लर्निंग और अर्निंग कुछ लेते नहीं, तो वो टाइम हमारा वेस्ट हो गया। अगर हम उस पे उससे कुछ बेनिफिट्स मिलता है हमको, तो वेस्ट नहीं होता। एज हाँ, हमारी थिंकिंग पे डिपेंड रहता है वो, हम उस पे क्या करते हैं। तो अगर आप अच्छा काम कर रहे हो उस पे, आपके स्टेट बढ़ रहा है उससे, तो ऑलवेज इज इम्पोर्टेंट आल्सो।
Okay, I'll add some points to that for Sadia's question. What we can do is, see, all of us love to have rewards, right? So as you know, Dinesh also pointed out during the goal setting, when we are doing the goal setting and moving ahead in our life, we need to reward ourselves, because unless we get rewarded, we'll not feel that enthusiasm or excitement to do something next, right? So keep that as a saving or an investment and keep rewarding yourself, right? Keep saving the money, and at one point of time, you buy a gift for yourself and reward yourself. So that way you can both effectively reward yourself also and save the time also and all your money also. Was it okay? Okay, Sadia?
Okay, sir, got it. Thank you. That means either we have to save or invest or earn.
Yes, exactly.
Whatever time is time or money.
Absolutely. Absolutely. So
Okay,
whatever time
thank
we
you,
have to utilize that time. And if our earnings are less, then probably we'll have to keep working more or better work and keep increasing the earning also, so that we can buy that expensive gift and reward ourselves. So thank you for asking that question. I'm sure that question was there in the mind of many other people as well, but they did not ask. So finally, with that, we come to the end of this presentation, final presentation. May I call upon all the stars to, switch on their videos, and we'll just have a final video call together. And then before that, we end. After that, we'll end the session. Dinesh, thank you. Vaibhav, thank you. We can see you. Swati, we can see you. Rajat, waiting for him. So excellent. How do you feel? Anyone? Dinesh, let's start alphabetically. How was the experience? You have to unmute and talk.
It was a wonderful experience. It is our first time, sir. That was previously nervous about that.
Excellent. So were you able to apply all these learnings that we did in last few months? We learned so many things. Was it useful?
Sorry. Your voice is breaking.
My voice is breaking. Okay, let me just. Okay, so was whatever we learned in last 3 months or so, Was it useful in applying those knowledge and skills to this presentation?
Yes, sir, definitely.
Definitely. And what do you recommend your, attendees today to take care based
What,
on your learnings? Based on your learnings, what do you recommend to our participants?
I recommend that all our session are interconnected, not a separate one. First, who have proper as well as to grab opportunities which are present everywhere. So you learn from any source and grab this opportunity.
Okay, perfect. Thank you, Dinesh, for that. Next, Rajat, go on. How was your learning important and how do you feel about this presentation today?
Yes, sir. First of all, thank you, sir, for providing this opportunity. After this presentation, I feel more confident to express myself, and that stage fear is completely gone, sir.
Perfect. And where the learnings useful, we learned so many other topics and
Sir,
other things
definitely.
during our last 3 months
Yes,
journey.
sir.
Were we able to apply those learnings here today, in today's presentation?
Yes, sir. We have to move towards applying it in a more efficient manner every day. I felt.
Perfect. Thank you, Rajat, for that. Swati, go on. How do you feel about it?
So it was very great learning experience.
Okay.
Yes, sir. And I presented it. I feel more confident. I can express myself in a more better way. Thank you for conducting such an insightful, meeting. It was a great learning experience, sir.
Great, thank you. So, Swati, what is your one suggestion to all those pharmacy professionals who are not on LinkedIn or who want to start their journey on LinkedIn, or who are already there on LinkedIn but they're not doing something on LinkedIn? So, three suggestions basically.
So they should connect with the various companies. They should start interacting. Basically, the problem is we are not interacting with people. We are not posting something, just we are using it. We are liking it. So we should share our thoughts first of all. And, we should share our contents so that we will we can approach and the recruiters can see us, our activities they can see. So that is the main thing I think which we are lacking right now.
Absolutely, totally agree with you. So, what is one suggestion for your juniors and batchmates?
Sir, they should first create their account. They should uh, means the description, everything they should fill it properly, and they should interact with various people and share their thoughts on LinkedIn. uh, just not making their account and doing nothing. It should not be like that.
Totally agree with you. So there are so many people who say, yes, I'm present on LinkedIn, but they know nothing about it and they don't post regularly. They don't interact with people and they expect miracles to happen. Even I used to do the same some time back. I used to expect all the stars to align. And then I was expecting that, okay, I should do something when all the stars align for me. That never happened. It will never happens for any one of us. So we have to basically take that first action, start something, and then the stars will start aligning depending on the kind of action we take. So absolutely, thank you so much for that note. Vaibhav, what do you feel about it?
Sir, it's very excellent learning journey for me, sir. And the session I was first time given an online live session, sir. That's first time I will have some fear, sir. But now it will some more confident and speaking very wisely, sir.
Yes, absolutely. So all of us need that first time option, and this kind of platforms definitely help us to get that breakthrough and create our own impact in the society. So thank you so much, Vaibhav, and thank you so much all the stars, and thank you so much all the participants who have spent so much of time with us today. It's close to 2 o'clock, right? We spent almost 4 hours today and interacting. We wanted to finish in 2 hours. We completed 4 hours, and still we have so many people attending. That in itself is an achievement. And I would like to, know some feedback, general feedback about this presentations from the participants. Uh, Please fill in the form, and if any one of you want to speak, you can just raise your hand. We'll unmute, and then you can talk and speak and just share your feedback on this presentation. How did you feel about it? And would you be interested to be invited in such presentations? Would you like to explore more on sharing your thoughts and knowledge with the world? Anyone wants to talk, you can just raise your virtual hand and then I'll unmute you. Meantime, I'll ask all the pharma stars to give a thumbs up. I'll take a screenshot and I'll be posting this on LinkedIn as well. Okay, so let's give a thumbs up, and then I'll just take a Rajat. He's missing. let's wait for it. Okay, so Rajat is back. Rajat, let's give a thumbs up, and then I'll take a screenshot of this particular. Yes, give a smile. Lovely, thank you. So I'll be posting this on LinkedIn. Please do interact. So any participants want to share their feedback, please, you are most welcome. Give us some feedback and encouragement, because we have been doing this for a long time now. And we are trying to impact some lives for sure. Each one of us. Okay. So no one, hopefully. I think Sadia can give a feedback if she wants to. Sadia, if you want to give a feedback, I'll welcome you. Sadia has been there with us for a long time, for almost 3 months. Sadia, would you like to speak for a second or two? Give me a thumbs up if yes. If no, then no problem. It looks like yes. Okay, she says yes. So, okay, Sadia, please, would like to hear from you.
Thank you so much, sir, and dear respected speakers for such wonderful session. I didn't feel that was too much long, but that was because they're very knowledgeable, insightful, and informative. I think I am senior among all of these, but these juniors are really built with confidence after attending our 21 days learning program. And I am learning from them also. I'll try my best to give my thoughts next time, but I can't assure right now. And thank you so much, sir, for your efforts, time, and thanks all of you, dear participants, for sharing your thoughts and knowledge. Thank you so much.
Thank you so much, Sadia. That was wonderful. Thank you so much. And thank you all the stars for gracing this presentation, sharing your thoughts, knowledge, and learnings. And I would like to thank each one of you who are present today on this Sunday. Since morning we have come to the lunch hour now, lunch past hour already. And please spend your time with your family now and have wonderful time until we'll make next time for something like this. So until we meet again, stay safe, stay blessed, and all the best. And I request all the pharma stars to continue their learning journey. Don't stop. Keep improving, keep learning, and we'll meet again very soon with something new. Okay, so thank you so much, all of you. And the link is there in the chat box. Don't forget to give the feedback. And all these feedbacks will be shared with all the stars, and I'm sure this will help us a lot. And personally, I'll be more than happy to get the feedbacks from all of you, and even the stars on other stars, right? Because this helps us to grow mutually, in a better way. Dinesh says, okay, give the feedback link. So here is the feedback link in the chat box. Use the same link. You can give the feedback to all the stars and share your learnings. That is very, very important, because each one of us have learned different things from different stars at the same time, right? So thank you so much, all of you, and we'll meet very soon for the next wonderful journey, learning journey. Until then, goodbye, take care, and have a blessed time. Thank you so much, and bye.
Thank you so much, sir.
Thank you.
Thank you, sir.
Thank
Bye,
you.
sir.
Thank you. Thank you.